Bus journey. This is an exciting and transformative time, and we want to ensure your journey starts off on the right foot. In this video, we will go over how to prepare for your first injection. You may have a lot of questions if this is the first time you're giving yourself an injection, but don't worry. We're here to put your mind at ease, support you on your journey, and equip you with all the information you need so you don't feel nervous at all. First and foremost, after a provider has reviewed your medical information and your prescription is approved, it will be sent to a pharmacy. If you haven't already, you will receive a package in the mail. Some of you may receive a package with an ice pack, while others may not. Since we work with several pharmacies, some pharmacies put their medication inside a sealed ice pack. It's important not to throw away the packaging. If your prescription did not arrive on a cold pack, it is completely safe. Pharmacies conduct excursion studies to ensure the stability and safety of the medication, and certain compounds have demonstrated safety even in heat for an extended period of time. Your health, safety, and the efficacy of the medication are our top priorities, so rest assured the method of shipment is safe. Let's now get started on preparing for your injection. Once your package arrives, it should contain the following supplies: your medication, syringes, alcohol wipes. Lay your materials out on a clean, disinfected surface so they are easy to access. Be sure the vial is on its bottom and on a stable surface, as the glass is fragile and can roll off and break. Wash your hands thoroughly to avoid any contamination. Be sure to read the instructions provided on your prescription bottle or packaging. It's important to note that every pharmacy compounds their medication differently, and instructions may vary depending on your pharmacy. Also, there may be instances where you receive multiple vials depending on the tier you were prescribed, and your package could include multiple vials with different instructions. It's critical to follow the instructions on the medication label. Next, look for the amount of units on your medication which has been instructed for you to inject in your first week. For example, 5 units, 20 units, 50 units. Hold your syringe next to the instructions to compare and ensure you are reading the lines marked with units. It's important to note that syringes may come in different sizes and units. This particular syringe can hold a total volume of 100 units, but certain syringes may only hold 30 or 50 units. Let's go over some basic syringe terminology: protective cap, the needle, needle hub, gasket, volume, aka unit, markings, barrel, and plunger. Make sure to align the top of the gasket to your prescribed units. Let's go over this 100-unit syringe. Here is 5 units, here is 10 units, here is 15 units, and so on. Next, take your vial and break the safety seal on top. Clean the top thoroughly with an alcohol wipe to avoid any contamination. The liquid inside may be clear or a different color depending on the pharmacy. Remove the orange safety cap from the top and bottom of your syringe. Hold your vial upside down. Next, puncture the rubber portion of the vial and extract the liquid. Sometimes the liquid extracts slowly, so you have to be patient. If you are a first-time patient, the amount of liquid will be minimal depending on the medication. If you're injecting semaglutide, it could be as little as 5 to 10 units. And if you are injecting tirzepatide, it could be as little as 15 to 25 units. Once again, we want to make sure the top of the gasket is aligned with the prescribed amount of units. Once aligned, flick the syringe to ensure all air bubbles have been removed. If you're not quite ready to give yourself an injection, cover the needle with the orange protective cap until you are ready. Be sure not to place the protective cap over the plunger, as it will squirt the liquid out. It's important to be sure you never use the same syringe twice, as it can contaminate the liquid inside the bottle. If you have to use more liquid than the syringe allows, be sure to use a different syringe. You are now prepared for your first injection. Watch our video, How to Give Yourself an Injection, for further instructions on injecting yourself. Congratulations, and best of luck on your journey!